All right, so welcome. Your health after 40 is our topic for today. My name is Abby Horton, and it's a privilege to be with y'all. We have some great upcoming events through the Wellness and Work Life Office, health screenings, wellness classes, and programs. And once you qualify and complete all of these different components to the wellness program, then you are eligible for a couple of different gift cards totaling about $100. And we want you to take advantage of all of the wonderful benefits that we have here at the University of Alabama. As an employee, these are the programs and things that are free for you that we want you to definitely engage in and participate with. So take a screenshot. If you are not on the newsletter for wellness.ua.edu, you can go to our site and sign up. And Miranda, Carolyn, Ashley, they are wellness work life, and so they will take really good care of you and make sure that you have everything that you need. And there's also a link so that if you need to ask for information or need to reach out, normally I give you my email and I will, but just in case I'm not able to respond, then definitely reach out to the generic email, and Miranda is probably going to be the one that answers you. And Miranda is on the call today, so she has put the subscribe link in the chat for y'all. So as my kids say, like and subscribe. So anyway, I am a registered nurse. I'm a certified health and life coach. I am your WellBama class educator, and I also serve as a WellBama ambassador for the Honors College, where I teach part-time. So our objective today, we really want to talk about some common health concerns for individuals over the age of 40, but I think it's so important that we actually talk about these things before we even get to 40, because the health that we're creating today, regardless of your age, is actually going to be what shows up, 6 months from now, a year from now. And so it's important that we are proactive in our health. And so discussing the importance of health screenings is always going to be something that we talk about in wellness because we really believe in prevention. And we want to talk about useful strategies for effective weight loss, wellness, health management for you, because we do see some health concerns that pop up around age 40 that are a little easier to manage when we're a little bit younger. We also want to talk about staying fit and how we can do that well, because we know our bodies are always aging and changing, and sometimes we will have some different issues with aches and pains or metabolism as we start to get a little bit older and our hormones change. And so just know that that's something that we'll talk about too. Thank y'all all for saying hello in the chat. I see some friends and some colleagues also in the chat, so it's great to have y'all here. So we might have in terms of common health concerns, and this is definitely not an all-inclusive list. We could go on for days and days and days for some of the things that we might have challenges with. But anything from chronic pain and arthritis that shows up to lifestyle changes, hormonal changes, and mental health concerns. And so it really does run the gamut. We, of course, think about weight and hormonal changes most often with women. That tends to be what we talk more about. For men, they tend to talk more about back pain and chronic pain and arthritis, although any of these things can certainly be a concern regardless of your gender or sexuality. And so, it's important that we are mindful of each person as individual. And so you may be dealing with inflammation now, but in a different season of age, you may be actually dealing with some of the other things like health concerns with your heart or blood pressure or cholesterol. And a lot of these go hand in hand. So I really believe in the wellness basics, and we have a class exclusively for those 5 wellness basics where we look at our hydration, our nutrition, our mindset, our movement, and our sleep. And those 5 things to me are really foundational to overall health. And when we get those things on the right track, you're going to start to see some of the changes that you're having and some of the health concerns that you're having actually start to resolve. And so definitely take a look at this list, but we don't want to stay stuck here. We want to actually talk more about how we can start to see improvements in our health. So it's always important to pause and reflect and reset. So Dr. Brene Brown is a social worker who studies social issues and mental health issues, and she's done a lot in that space around, how we show up well for our lives. And so what she says about midlife is that it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open up everything back up to heal the hurt. And I think that's important to think about because sometimes we have this doom and gloom mentality around aging. There seems to be something about turning 40 that is difficult for us in our society, at least in the US. And so we want to think about, do we have that kind of doom and gloom mentality about our health and about our fitness and about turning 40 or about being over the age of 40? Because sometimes we do. We say things like, you're over the hill, or, life is half over. And if we approach our health and our life in that way, we're probably going to be manifesting some of those things into reality that really may have not come up for us if we hadn't had that mindset. So midlife is not a crisis. Midlife is an unraveling. And I say that in the best way possible because we start to really reflect and figure out what life's all about, what's important, what isn't. And we can start to take more ownership and, take our power back in terms of our agency of, yes, we may be 40 or we may even be beyond 40, but that doesn't mean that we can't still have health and wellness, that we can't still enjoy our lives. And I always believe that the best is yet to come. So the best years, I fully believe that we haven't lived those yet. So I think that's an exciting way to think about aging. So screening and prevention is really the key to healthy living. And knowing your numbers is something that we say a lot in nursing, and we certainly say in Wellbama. And that's why our programs are so well geared toward helping you know your BMI, helping you know those weight fluctuations that you may be experiencing, which it's typical for all of humanity, that we're going to have different fluctuations in our weight, depending on the time of the month, depending on what we had for breakfast or lunch. And so that's typical, that's normal. And we also want to make sure that we know our blood work numbers. What is our cholesterol? What is our total cholesterol? What do we need in terms of, lab values? Are we, deficient in certain nutrients? What's our blood pressure? Those are all important things to know and things that you can find out by doing your wellness screening. And our nursing students are usually going to be your coaches. Sometimes we have med students help with those as well. But knowing your numbers is so, so important. And one of the things that we can also look at is just your overall health risk, your activity levels. We can tell you your blood sugar, your cholesterol. We can give you some indicators about your heart health, your triglyceride, and all of your little basic, vital signs. We calculate your BMI, and then we talk to you about goals that you would like to set. And some of those are wellness, fitness goals in terms of the traditional, I want to lose weight, I want to run a marathon, I want to do a 5K. And we have a lot of great programs that can support that. But you also have goals such as we want to increase our vegetable intake. We want to eat more veggies every day. Or it may be that we want to set a financial wellness goal. So wellness is not just about our body and our brain, but it's also about the way that we approach our lives. But these wellness screenings are a great way to come and take advantage of some of those free services and get to know some of those numbers. Even if you go for a yearly physical exam with your healthcare provider, which we 100% recommend, it's still nice to get a free check. So an annual physical exam is something that we recommend every year. And it could be with your nurse practitioner, it could be with your physician. We don't typically see physicians associates doing those exams here locally, but it might even be a PA. And we want to use these for screening for medical issues that might come up. Blood pressure is one that we typically will see screened for. We want to assess your future risk of health issues and medical issues. We want to be able to coach you and encourage you on a healthy lifestyle. Maybe you need a referral to a registered dietitian nutritionist. Maybe you need a life coach, which we offer here through Wellbama. I provide those services to y'all for free. Maybe it's that you need, maybe you need a personal trainer. Maybe you need to go to the rec center and join a membership. I believe that's around $28. And Miranda usually pops that in the chat when I start referencing things on campus. And so that's usually around a $28 monthly fee. That's a great, phenomenal price for a gym membership. Maybe you need to go in and get routine immunizations. That's so important. And then helping yourself build a relationship with your primary care provider or your PCP, whether that's your doctor, nurse practitioner, physician's associate, whomever that may be. Developing a relationship is so important because when you do have a health crisis or when you do have something come up with your health and wellness, you already have established a relationship and you're not there when you do find out that you have a tumor like I have, or when you find out that you do have high blood pressure or diabetes or a new diagnosis. it's a little easier to have those conversations because they already have an idea of the challenges that you're having. And so they can talk to you about your lifestyle changes and what would be applicable to you. And that just makes that conversation so much better. Miranda, thank you for popping those things in the chat. I have a couple of questions that came in the Q&A, and it says, what's the average age that women go through menopause, and at what age do we need to get a bone density test? We'll definitely talk about those, so I'll circle back to that. Thank y'all for asking. Feel free to pop those in the Q&A or in the chat. Okay, so some recommendations. The annual physical exam, we want to make sure that you encourage your provider, if they're not already doing blood work every year, to go ahead and get labs done, and they will determine what's appropriate for you. A dental exam, we recommend that every 6 months unless it's needed more frequently. Our plan typically covers 2 dental exams and cleanings a year. And sometimes you may need to go more frequently, especially if you have anyone wearing braces. It may be that you need to go every 3 months if there's a high risk for cavities, especially if you're using Invisalign. That can be a concern in terms of cavity formation. We're also hearing that people are recommending in orthodontics and in dental exams that you start using an electric toothbrush, because that will be better, particularly if you have button attachments, which you have both with Invisalign and with traditional braces. That can really help prevent tooth decay as you're straightening your teeth. So that's something that is being recommended more frequently now. Hearing screens, which are so important, the health screening that is going to be taking place at the Capstone College of Nursing this semester actually is going to have a hearing screening, which sometimes we do not have that at every screening here on campus. So that would be a really good one to take advantage of. A comprehensive eye exam is important. So if you do wear readers, or if you do go to the optometrist just to check on your eyesight, you may want to consider around age 40, if you aren't needing to go earlier because of other health concerns, to see an ophthalmologist every year. And then they'll give you a plan. Sometimes you need to come back every year. Sometimes you need to come back every 2 or 3 years. They'll personalize that to you. But a lot of times they will want to do a screening around age 40 to make sure that all of your ophthalmic nerves and all of your retina, everything is in good working order. If you have issues with cardiovascular health, if you've had a history of cardiovascular disease, if you have high blood pressure, high cholesterol, those are the kinds of things, diabetes certainly, or metabolic syndrome, they're going to want to check your eyes a little bit more frequently, especially checking their pressures and making sure that they know how thick your lens is, because that will impact your pressure. So all of those good things will be helpful to have screened with an ophthalmologist that you're not going to get at your local optometrist office. So that's really going to be looking more at your visual acuity, or what size and type of readers that you need. Blood pressure checks, cholesterol checks, checking your blood glucose, checking your hemoglobin A1C for your diabetes screening. All of those are really important as well. Some will actually even do a baseline EKG if you are having any symptoms, or if you have a strong family history. So that is one of those that you don't see done frequently, but you will sometimes see an EKG order. So don't be frightened if that's the case for you. And then also a thyroid check. So it depends on your provider and your health risk if they do a thyroid check. I always recommend that you ask for that, and you'll know if you've had one done, because it's not the most comfortable feeling. But they'll actually stand usually behind you or to the side of you, and they will take their fingers and they will palpate on your neck. So just pressing lightly on your neck, one side and then the other, while you swallow, and they'll have you tilt your head and all sorts of great things like that to be able to assess your thyroid. But that's really, really helpful. I think it's important for everyone to get a thyroid check at least annually. Certainly do what's appropriate and recommended by your provider. But my husband was diagnosed with thyroid cancer in 2009, and he was diagnosed because of a series of events that the physician actually did a palpation of his thyroid and found a nodule, and they were able to get him in for a biopsy. And within a week of that, they knew that he had thyroid cancer, and he had to have a total thyroidectomy and treatment for that cancer. And he was in his early 40s. And so that's something that is really important just personally for me. But we see so many people with hypothyroidism today that I think it's important. Of course, you can have hyperthyroidism too, but you want to make sure that you are taking good care of your thyroid, because it is our engine for our bodies and gives us lots of good energy. So definitely think about that. Hormones play a role with your thyroid. So for females, they tend to be a little bit more likely to have hypothyroidism and to be impacted if the thyroid is just not working optimally. Some other healthcare recommendations, of course, your standard immunizations, things like the flu, the tetanus, getting your boosters, the pneumococcal vaccine, your hepatitis series. You might even, of course, think about your COVID-19 and your COVID-19 boosters as appropriate. Colorectal cancer screenings usually start around age 45 now. 50 to 45 has been what we've seen, unless you're high risk. But because we're seeing an increased prevalence of colorectal cancer, they're now recommending that age 45 and above start to have those screenings and a colonoscopy every 10 years, unless you need to be screened more frequently. Some physicians may, even if you're lower risk and you're younger, may do something like a fecal occult blood test, or you can do the immunochemical test, and those are going to be more of a first level screening tool. I'm looking at blood and stool to be able to see if you do need some more extensive testing. So those are also going to be recommendations that you may not have seen until you get to that age 40 bracket and above. We also want to recommend that you think about your nicotine use, your vape, your tobacco, all of those kinds of products, even your caffeine use, are going to be things that are more impactful to your health as you age, because our bodies just sometimes will build up a tolerance to them, and sometimes we just become very intolerant of substances that we've used in the past. Caffeine, for one, is something that we don't often talk about because it's just so normalized that we drink coffee and that we have, Cokes and things like that. But for me personally, in advance of this surgery, I had been told that I needed to wean off coffee and caffeine. And a lot of you on the call know me. And so you know that I always have a coffee or some caffeine source in hand, and that's been hard. But now, I'm almost a week from having had, 1 to 2 cups of coffee every day. And I can say I feel absolutely so much better without the caffeine, but I do miss, having my coffee in hand. And so I've got my water. I've replaced it with my water, but it's not quite the same. But you do tend to feel better without so much caffeine, but do wean yourself off. And if you love coffee, coffee can be very beneficial for you, especially if you're making sure that it's a clean source and you're not getting a lot of exposure to like mold, because coffee, peanuts, things like that, think of high allergen foods. Those are the foods that tend to also have high mold or mycotoxin content. And so you just want to make sure that when you're drinking coffee, you're making a really healthy choice in terms of when that's a clean brand and that screens for those kinds of things. Making fiber your friend is also important. As we age, sometimes our motility in our stomachs, just our ability to digest our food starts to slow a little bit. You'll hear people say, oh, I'm getting, to be around 40, yet my metabolism is slow. Well, there are things that you can do to prevent that. Just because it's common doesn't mean that it's kind of normal or expected, in air quotes. And so definitely adding fiber, drinking more water, about half of your body weight in ounces a day in terms of water intake, which is usually around 100 ounces or less, but usually no more than 128 ounces, because you can overhydrate. So you want to make sure that you're keeping a check on that. And then building muscle and working toward good bone health. So there was a mention of the bone density scans. Again, you're going to see anywhere from age 40 to age 50 be a recommendation for bone density scans. Some even have you go longer. It just really depends on your risk factors for developing osteoporosis. And we've always taught that we should drink a lot of good milk, because milk and dairy is a good source of calcium, and that can really, help with your bone health. But really, we are seeing things like, fruits and vegetable, oranges. If you look at the fiber content and you look at the health benefit of the foods that you're eating, you actually can get better sources of calcium from those fruits and vegetables versus dairy, which a lot of us have an intolerance to. Not just that there's a lactose intolerance, but just that milk and dairy, especially conventional milk, a lot of times can cause some inflammation and can cause a lot of mucus buildup. And so if that's an issue for you, you may want to think about other sources of calcium. It's just that's the commercial we see, and that's the commercial we grew up on. And so, it's just we believe that because that's what we've been really kind of having at the forefront of our minds. But there are other better sources. So some additional screenings, and we do this by women and by men because that's how things are studied right now in the U.S. literature, at least. And know that this, is not inclusive in terms of people who are not on, this binary gender spectrum, but we're wording it this way because that's how the recommendations are worded. So think of this more as your predominant hormones versus men or women. So thinking about having more estrogen and progesterone on board in your body versus having more testosterone on board on your body. So for additional screenings for women, it would be things like a clinical breast exam, which is also important for men. Men can also get breast cancer. So you're not going to traditionally see that under the male screening, but I would say absolutely everyone needs to be screening for that. The monthly self breast exam. So we say once a year you need to have a clinician. So some healthcare provider do a breast exam for you, but also that you need to be doing a monthly self breast exam, and you need to schedule that after your monthly cycle so that you're not having soreness and tenderness, which you can sometimes have. Mammograms as appropriate. There's also some options for thermography. So going to a clinic to have, almost like a thermal heat exam done on your breast is a little bit of a step up from a manual breast exam, either that's done by a clinician or yourself, but is a little less invasive than a mammogram. For women who are younger than age 40, mammograms usually aren't recommended because we tend to have denser breast tissue. And so you might even hear the term fibrocystic breasts because they're just so dense. We don't really call it disease anymore, but that's certainly something that we used to label as a disease. But what we've learned is that women just tend to have more dense breast tissue. And so it's harder for a mammogram to see everything in totality. So that's why it's important that you're doing those manual, meaning that you're taking your fingers and pressing. And so definitely think about that. A pelvic exam with your OBGYN or GYN, having a pap smear test. We were doing those once a year. And now some providers will actually go out as long as 3 years, depending on if you've ever had a positive test or an irregular pap smear and your risk factors. It may be annually or it may be up to 2 or 3 years where you have another. And so, again, we always try to do the least invasive thing. And so that's a good thing if it is, within the parameters for you. And then bone density usually is just as recommended. Again, usually, unfortunately, you start having some issues with your bone health before you start getting those tests. But certainly, if you want to ask your provider, then they can give you an idea of what's appropriate and how you can walk through that. And then for men, an annual testicular exam. Again, this is going to be a clinical exam with a provider. It may be a family doctor, or it could even be a urologist, depending on your risk factors. Certainly, urology is going to follow you for prostate screening. So if they're concerned that you might have an issue with your prostate, then you're probably going to get a referral. And you also can start having those annual prostate exams around age 50, unless you have some concerns that there may be a reason to screen earlier. And then monthly self-testicular exams are also important for men. And usually what we say for men, because their hormonal cycle is different, is just like to pick your birthday. So if you're born on, the 10th of the month, then the 10th of every month, you're just going to remember that you would do your self-testicular exam to check for any lumps or bumps or bruises or masses or anything that just feels tender or just feels painful. Any changes in those things, whether it's your breast or your testicular exam, then you'll just want to let your healthcare provider know, and then they can do a follow-up and ask you some good questions and help you navigate that. So hormonal changes for women, we talk about premenopause, perimenopause, and postmenopause. So pre is before you start having any menopause symptoms. Peri means around, so it's around the time of menopause. And then postmenopause. So we had a question about, when do we normally start seeing menopause occur? For women in the US, it's anywhere from age 45 to age 55. And that is typically lower than other industrialized countries in the world. So women in the US tend to go through menopause earlier than the rest of the world. We also tend to have more symptoms than the rest of the women in the world. So with postmenopause, really, we don't look at it in terms of an age because everyone is so bio-individual and unique, but it just is after about a year of you've not had any bleeding with your monthly cycle and you've not had any breakthrough bleeding, then you can see that usually you're then coded as postmenopause. And so that's important to some folks, but not to others. Really, it's more about, anticipating those changes. So no menstrual cycle for 1 year is when you're going to, really have that, kind of, and I don't want to say diagnosis, but that label of menopause. And the reason we think about it as a medical term is because so many women have symptoms. But I think, again, it goes back to just because it's common doesn't mean that, it's quote unquote normal or expected. It doesn't mean that it has to be that way for you. So the average age then for menopause is 51. And we see women in the US have things like hot flashes, vaginal dryness, mood swings, decreased mood, decreased libido, decreased focus and concentration, a lot of sleep issues like waking up in the middle of the night at 2 or 3 a.m., which is not uncommon to hear, hair loss, weight gain, and then metabolic syndrome, which I talk more about in our cardiovascular overview that we just offered a week or so ago. But that is an increased risk for cardiovascular disease or CVD, stroke, blood clots, type 2 diabetes, and there are a number of factors that make up your metabolic syndrome risk factors. So if you're interested in that, you can go to our wellness.ua.edu and go to archived webinars, and there's an hour-long talk about that. It's one of my favorite talks because it really debunks a lot of myths around cardiovascular health and inflammation and cholesterol. So you can learn more about how to kind of take care of some of those risk factors. So for men, we think about hormonal changes with women. Sometimes we think about it with men. We're hearing more about it in the news media and on commercials because we have a lot of former football players and athletes talking about low T or low testosterone. But about around age 40, we see that testosterone levels begin to drop, and they can drop by 1 to 3%. Testosterone, when that drops, it's not just about, a libido or a sexual health issue, but really testosterone, and then for us, estrogen and progesterone for women, those are going to be driving a lot of the cellular function and just energy that you have. And so if you're having those hormonal changes, it's not just about sexual health, which is important in its own right, but it's also about you're just not going to function and feel good overall. And so symptoms like decreased libido, hair loss, fatigue, mood changes, loss of muscle mass, increased body fat, especially around the abdominal area, same for women, decreased bone mass, memory issues, lack of motivation or depression. So this can really look like midlife crisis, particularly for men. And so I definitely want y'all to think about that because sometimes what looks like a midlife crisis could actually be a hormonal issue. And what could look like a mental health issue could actually be a hormonal issue. So we need to always rule out a physical cause before we just assume that it's a mental health or a lifestyle cause. All of those are important. It's just sometimes, you're not going to be able to get to a point of feeling good and feeling well if the physical cause is still there. And that's why we say find the physical cause first. Anemia, and that's really important and a very telling sign for men because usually unless men are having an active source of bleeding, unlike women, where women sometimes their cycles get, kind of the accountability for anemia. When a man has anemia, you really have to think about, is there, a reason that they're bleeding? Is there something that we don't know about that? Or do they have low testosterone? So a lot of times you're going to see anemia show up for men, and sometimes it gets dismissed, but that's a very, very telltale sign that something's going on. You can also have low semen, and you can have erectile dysfunction issues, and that also goes hand in hand with blood pressure medications. And so for men, you also tend to see a rise in blood pressure medications around this age, and that lowering of the blood pressure is also going to contribute to probably the low mood, the low, libido, but also it's lowering your blood flow. And so that's going to sometimes lead to erectile dysfunction. And that's sometimes when we see why men don't actually take their blood pressure medication as prescribed. So a lot going on here. So some other changes that you can see in your 40s is decreased digestive capability, decreased metabolism. Your cells, the growth rate of the cells tend to decrease. You have lifestyle changes, so you kind of end in that, sandwich generation of you're starting to have more responsibilities at work, but also you may, if you have children and parents who are in your lives, you may be in that sandwich generation of caring for young children and thinking about aging parents or aging loved ones. And so you can definitely have a lot of lifestyle and stressor changes in this area of life. You also are kind of in that midpoint of you may not be having a lot of milestones that are occurring. And so a lot of times people can feel just mentally like they're in a little bit of a stalemate, like there's not something to look forward to. So that can impact mood. And then you add on the hormonal changes, and that can really be something that feels a lot like a midlife crisis. Then you also tend to have the weight loss resistance because of these other factors. And again, we can't talk enough about how stress plays a role in that. So this is going to be a chart for what you can see in terms of the weight that you have currently, the resting calories that you may need, how much activity that you're having. Are you sedentary? So really low activity. You're just kind of walking to and from point A to point B. Or medium activity. Are you doing some light walking? Or high activity? Are you actually, engaged in a formal exercise plan? So these are some numbers to help you kind of, estimate where you are and where you need to be with calories consumption. But it's also important to think about not only your calorie consumption, but how many chemicals you're consuming. Because, people will tell you that a calorie is a calorie. And that is true in terms of weight loss, but your body does different things with 100 calories of M&Ms versus 100 calories of broccoli. And so the processed chemicals that we take in are going to impact our inflammation. It's going to impact our, vitamin consumption. We really need to be in rest and digest when we're eating. So if we're always eating on the go, I used to be very much the person who was eating a full course meal while I was driving my minivan from point A to point B. I no longer eat in my car because you can't be in rest and digest when you're in traffic in our town. So you've got to really think about, setting yourself up for success. And what I find is the more you focus on wellness, the more kind of impactful it is to your overall weight loss. If you're really only focused on weight loss, that's hard. If you focus on adding in good things to make wellness, a part of your lifestyle, then the weight tends to kind of take care of itself. So with that being said, I alluded to the wellness basics earlier, and we call them the 5 to thrive. So sleeping well, not that you're just getting the quantity of hours of sleep, 7 to 8, but you're also, getting quality hours of sleep. So if you're waking up feeling worse than when you went to bed, there may be something going on with your sleep or your environment that you might need to have a referral and go see a sleep specialist, which is usually a neurologist. You may have a sleep disorder, or you may have young kids or a dog that barks, or a really loud neighbor that's waking you up and you're not realizing how disruptive it is. Staying hydrated is important. Again, about half of your body weight in ounces a day is the recommendation, but usually not more than 128. Your urine is going to tell you the story of how hydrated you are. Just remember that you want your urine to be a pale yellow color. You don't want it to be clear because then you're probably overhydrated and you're probably flushing out all those good electrolytes and minerals that you're eating. And so, and just remember that when you're looking at your urine in a toilet, that water in the toilet is actually diluting your urine. So it's probably going to look a little lighter than it actually is. So you can take a cup, like a disposable cup, and use that if you're wanting to check and kind of keep track of your hydration status. And I think that's important until you kind of learn your body. For me, if I'm at the hospital, I'm going to drink more water when I get home because I'm going to be dehydrated. If I'm teaching a 3-hour lecture, I'm going to drink more water. If I'm having an office day, I don't need quite as much water on that day because I'm seated, I'm not talking as much. And the more I talk, the higher my respirations are. Which is true for everybody, but it's really true for me because I'm a fast talker. And so I'm going to be doing more respirations. So I'm going to be getting rid of more of that moisture and that hydration. So I'm going to need to drink more water on those days. We really want to strive for a healthy plate. So half of your plate in vegetables a day. And we say eat the rainbow. So you want to have a lot of good colors. We tend to only eat beige and brown food. And then when we need to feel healthy, we'll add in something green. But we want to make sure that we're eating the reds, the kind of the blues and purples, the oranges, the yellows, because that's giving you different antioxidants that you wouldn't get if you're just eating, bland beige food and then some grains. Moving your body every day is so important. That does not mean that you have to run. That does not mean that you have to be in CrossFit or Orange Theory, and all of those are great. But if you're not doing any movement, just adding in 5, 10, 15 minutes, working your way up to 30 to 40 minutes, 3 to 4 times a week is a good place to start. And I think that that is more doable over the long run for most people. I think walking and swimming are my 2 favorites to recommend to people because they're really low impact and accessible to most. Of course, swimming is a little less so walking is probably my favorite. But moving your body is important. If you're not moving at all, then a dance party while you're waiting on supper to cook. Maybe the water's boiling on your stove, do a dance party. Maybe walk after your dinner tonight. For many people, there's a study that shows most people will have that spike in their blood sugar and their insulin after their meals. And it takes a long time for that to really get back to normal and back to baseline, especially the later that you eat at night and the less movement that you do. So taking a 30 to 60-minute walk, which is not always doable, has been shown to help get that blood sugar range back down within more like 20 to 30 minutes for most people. And that's really, really helpful for your overall health. Focusing on blood sugar and your inflammation are going to be 2 things that help you as you age and help you age well. And then meditation. So taking 3 to 5 minutes a day just to start is important. So maybe you schedule a 5 to 15-minute break in the morning, in the afternoon, and in the evening, especially as you're trying to wind down for bed. Even using something like an app, maybe a meditation app, or listening to some soothing music, closing your eyes for a few minutes, getting up and taking a walk around, your neighborhood, or if you're at the office, around your office, can be really helpful in terms of just giving your brain a little bit of a break and not continuing to kind of overwork and push yourself through. That will do a lot for just your overall wellness. I say sleep is for the body what meditation is for the mind. It just gives you a little bit of time to disconnect and reset. And we're not meant to hit snooze in the morning and go all day. And then like a light switch say, okay, it's time for bed now. And then we wonder why we have sleep issues. It's because we're kind of treating ourselves like a computer, like we're just turning ourselves on and off. And that's not really how we work, unfortunately. I would love to be a robot, but I don't work like that either. Overcoming changes of weight management. This is so important of how to lose weight well. And again, it's because when we focus just on calories and moving your body, if that worked for everybody, nobody would be overweight. And most Americans are overweight today. And so there's 4 classes of obesity, and I was in the morbid obesity category 3 to 4 years ago. And I recently lost 81 pounds. I am counting that 81st pound. And so I had to work for every single pound because I had a lot of weight loss resistance and a lot of inflammation. And, for me, moving my body and eating fewer calories, I was restricting my calories so much that my body was hanging on to extra weight. I eat more now than I did 80 pounds ago because I can do that because I'm focusing on wellness and not calories. And I'm looking at chemicals and preservatives and eating cleaner sources of food. And so it's just the whole picture. It's not just about calories and moving your body. And I have tried every fad diet that has been around since the 90s. So I can tell you, I've done everything from the military 3-day diet, or eating a popsicle and a hot dog, to Weight Watchers, to Slim Fast shakes. I mean, the whole gamut. And so definitely know that I understand the frustrations around weight loss. Keeping your blood sugar steady is really important, trying to avoid those rises and falls or those peaks and valleys. That really contributes not only to fatigue and hunger, but also when you're having those many fluctuations in your blood sugar, it's affecting your mood and your focus and just how your brain is functioning too. When your blood sugar drops low and kind of, bottoms out a little bit, you're not going to be able to do anything well, and you're not going to be able to do it in a happy frame of mind because your body is trying to get your attention to tell you to eat. It's just a life-saving mechanism. And so you're not going to be the most pleasant. And my husband has diabetes, and I can always tell when his blood sugar is getting low because he gets grumpy. And I'm like, have you had a snack? Have you checked your blood sugar lately? And if you do have blood sugar issues and you qualify for continuous glucose monitoring, if you have diabetes, that was a huge game changer in regulating his blood sugar, because that gets harder and harder as you go through the diabetes process and as that can advance. And so he was really hesitant with that. And so he has said that I can share what a great source that is. A lot of people who are really into wellness or who are doing keto diets are doing continuous glucose monitoring out of pocket, because it just tells you such great information about how your body responds to food. And all of us are going to respond differently. If we all had ice cream right now, our blood sugars would all do something really different. Probably would all rise, but it's probably going to be different in terms of how much they rise and then how quickly they fall, which is what really makes us feel bad. When we have a big spike and then it drops off, that's when we feel so fatigued. And that's when it's most concerning. What goes in does have to be burned off, but again, you have to think about, 100 calories of M&Ms versus 100 calories of broccoli. Your body is going to use those very differently, and nutritional value of those are very different. So just eating 100 calories more a day can lead up to a 9 to 10 pound weight gain over the year. And so just something as simple as dropping off, some extra Cokes and coffees could really help you in terms of losing weight over the long term. And then checking underlying medical conditions are always important. Maybe you do have a thyroid issue. 1 in 5 adults over the age of 40 tend to have hypothyroidism, and those figures are going to fluctuate. We're getting more data in all the time that's actually showing more hypothyroidism than just 1 in 5. But that's an estimate. And so again, that doesn't mean that if you're not in that 1 in 5, you may not be working optimally. And so that's something to check. Hormones are always something to check. Insulin resistance, that can be checked by pulling a couple of different numbers and looking at the ratio of those, of your cholesterol, of your BMI, and of your HbA1c, your hemoglobin HbA1c. So those are some things that you can look at over time to see if you do have weight loss resistance. And when I did my numbers and I started on my health journey, that was a huge part of the challenge that I was facing. And for most people who do calorie restriction, that is going to be an issue because your body is trying to compensate. So boosting your metabolism, I always think that it's more fun to add than subtract. I don't love math, but I liked addition better than subtraction. And I think most people do. So the more good things that you add in, I don't want you taking away my Chick-fil-A Coke, although I did give that up this year. But instead of saying, I'm going to take away my Coke or my coffee, say, you know what, I'm going to add in a juice. And so for me, that's been a big part of my story the last few months, is drinking 16 ounces of juice that I juice at home a day. So I use one that has lemon and ginger and kale or spinach, and some organic apple juice with no sugar added. It makes it a little sweeter and a little more fun to drink. And I have that at some point during the day for breakfast or lunch, in addition to my food. So it's not a meal replacement. I think of it as a supplementation. So I'm drinking my vitamins instead of taking them by mouth in a pill. And our bodies are just able to digest and respond to that a little bit better. So I always prefer to eat my nutrients versus taking them in a supplement. But you do what you need to do. So if you need to get extra supplements in and you can't eat it in, its raw form, then do that. That's always better than not doing anything. Monitoring your caloric intake and how much you're expending. So, looking at your activity levels, avoiding those empty calories. If you're eating 100 calorie snack packs, sub that out for 100 calories of some fruits and vegetables and good protein, some string cheese if you can tolerate it. Those are always going to be better than anything that's packaged. Hydration is very important. Again, you're going to feel low mood, low concentration, lack of focus if you're not hydrated well. That's also going to lead to things like constipation and bloating because your body needs that, that energy source of the hydration. Increased fat burning ability is really being shown with HIIT workouts or high intensity interval training and strength training. And so, we love cardio, we love to run, we love the treadmill, we love spin classes and all of that. I think that's great. But for me, I have a low tolerance for that. I just don't have the capability, like at the cellular level, to be able to do that good exchange, to not feel like I'm out of breath all the time. So some people respond really well to cardio. Some people need more strength training and HIIT style workouts where you're just doing a little bit of spurts of cardio. There's actually genetic testing, and I've done that, and I think it was very beneficial, or you can figure out what your body responds to best. But really, you don't really need genetic testing to know. You know if running is miserable for you, or you know if you love it. You know if you feel great after you lift weights, or if it's a real strain on your body. And so working with someone who can help you, I did a boot camp a few years ago, and that was pivotal in me getting on this health and wellness journey, because I had someone who could tell me if my form and technique were good, if I needed to change something or modify something. It's hard to do that for yourself, even if you have good knowledge of fitness and all of that. So highly encourage you working with someone who can help walk alongside you if that is something you need. And then, like I said, moving your body every day. Park further away from the building on campus. Take the stairs. Walk around your neighborhood. Set your alarm so that you're getting up every hour and walking around, just so that you're not sitting all day every day. And again, fitness over 40 is something about, being intentional. It's about making intentional choices. So exercising at the time of day that feels good for you and when you feel motivated. We often tell people to exercise first thing in the morning. Most people really don't, love that. And it's hard sometimes to do that. So you don't want to exercise too late in the night. It's going to affect your sleep if you do. But if you can exercise after work, and that is something you can do consistently, to me, that's better to do it after work consistently than to be miserable doing it consistently in the morning, or to be inconsistent in the morning with it. So it doesn't always have to be first thing. Scheduling your exercise is important, and make it a meeting with yourself. I know several of you who are on the call are very dedicated to exercise. And I think that that's what it requires. It's a discipline. It's a habit. It's not that you need motivation, because motivation comes and goes. But it's that you decide, I'm going to do this. I am a runner, not that I run. I am a weightlifter, not that I lift weights. And so I am a healthy person, not that I'm just eating healthy food. It's a mindset thing. And then try to avoid all or nothing thinking when it comes to exercise. I am a perfectionist, and I am so self-critical that if I miss a day, then I'm like, oh, well, I just need to give it up or start over because I messed up my habit tracker. But the thing is showing up consistently is going to be more important than showing up perfectly. And the more times you can show up, the better. So try to never miss 2 days of anything you're trying to do in terms of habits. We do have a talk on habit change. I love that one too. Y'all can go check it out. But try not to miss 2 days. So in exercise world, we say don't ever miss a Monday, and don't miss more than 2 days in a row, because it's just so hard to get back on track if you do. Habit tracking, using a habit tracker is also a good way of motivating yourselves too. So walking, these are 5 reasons to, get up and walk. Walking's low impact. It's great for the body and the mind. Hopefully you're getting out in nature. Nature walks, so being outside walking versus being indoors, tends to have more of a helpful impact on like your stress hormones like cortisol. Walking helps digestion, and it can promote good bone health along with your weight training. That, lifting weights is going to be great for your bone health, more than the milk that we're drinking. So other tips, thinking about stretching all of your large muscle groups for a few minutes before you start to exercise. So always stretching is helpful. Don't just like get up and run, or don't just get up and do, exercises, but really stretch your muscles and do that head to toe, using things like, rollers, foam rollers, or tennis balls. Those can be good to help work your muscles and get those looser. You definitely want to pay a lot of attention to your hips and your hamstrings, because those can really be tight and can lead to injury because we do so much sitting today. Using all of your muscles are important. So, do something that's going to make you really stretch. So walk, run, do yoga. Pilates is great. There's so many great ones that you can try. Vary your workout routine. So if you run 3 days a week, then maybe strength train 2 days a week. If you cycle, then maybe you do dance, or you swim, or CrossFit. But something that's going to be a strength training and a cardio would be really great. And then vary that up, because one, it keeps your body always guessing and your brain always guessing. So it's having to adapt to your exercise. But two, it also gives you something to look forward to, because you're always trying something new. For those of you who are motivated in that way. Some people are really disciplined and y'all can just do the same thing every day. So that's great. That is not me. My mom ate oatmeal every morning for 40 years and worked as a nurse, and she had the same routine. That is not what I love to do. And so I need variety. So y'all do what works for you. Pace yourself, workout intensity and duration are important. But again, you don't want to burn yourself out. So doing, 23 minutes of a 30-minute workout is better than doing 0 minutes of a 30-minute workout. Some other tips, I'm not going to read all of these to y'all, but there are just some things that you can think about. I want to leave you with the making incremental changes, because you really want to just baby step your way. Like I said about addition, instead of saying, I'm not going to drink Cokes anymore, say, I'm going to drink 30 ounces of water today because I'm currently drinking 0 ounces of water. And I'm going to add in, an 8-ounce glass of juice that I've juiced. You can do that in, any sort of like home food processor, blender, you can make it work. You don't have to have a fancy juicer, but, I'm going to drink a juice and I'm going to drink 30 ounces of water today versus I'm going to, stop drinking 5 Cokes a day. That's going to be a little bit easier for you. So this is just a little checklist for you, and Miranda will share the slides in the chat. And then these are some things 40 after 40. So 40 habits after 40 that you can start thinking about. But again, I love these for any age. So things that you can think about, spending quality time with your family and friends, asking for help when you need it, repeating positive affirmations, standing more than you're sitting, stretching every day, being consistent in when you go to bed and when you wake up, being playful, having fun, knowing why you want to be healthy. Is it because you want to run a marathon? Is it because you want to do a weightlifting competition? Is it because you want to be able to play with your kids or grandkids, or future kids and grandkids? Is it that you want to travel the world when you retire? Like, what is your big why? Taking care of your mental, spiritual, and emotional health is also a big factor in that. And, connections, it's what it's all about. I've talked about this in the last few talks I've done. My own current health situation has made me really do a lot of this reflection myself personally. And when you look at the Harvard study on happiness and longevity, what they determined is that human connection and relationships are the things that keep you happy and healthy over the long haul. So they did a longitudinal study that looked at, generations of a person's life, decades and decades. And it was human connections and relationships that really was the determining factor, not the wellness metrics that we sometimes think of. So I think that that's really neat. And then there are some special considerations. I'm going to go through these quickly because I mentioned most of them, but the sandwich generation, when you feel like you're caregiving and you just have a lot of responsibility, I think that's so important to carve out time for yourself and to have some, friendships. Maybe you need to have mental health counseling. Maybe you need respite care. Maybe you need a support group that understands your particular challenge. I think those are all great ways to handle particular situations that maybe your neighbors and your colleagues don't understand. Pain management is so important. We think about, rest, ice, compression, and elevation, and over the counter pain medication. New study just came out recently that said that rice may not be the best technique, so that may be changing soon. That sometimes, resting and compression and elevation and putting ice on it may actually inhibit the healing process in the body. And that study was done in like the 1950s or 60s. So it's been a while, and people are looking at it and saying, no, that, you may actually need to move and you may actually need to use heat. So ask your healthcare provider if you do have an injury or something that's prolonged, that you're not able to kind of manage at home. But again, things that you need to be able to kind of avoid is like lifting, pushing, pulling if you do have issues with pain. And you don't want to be in chronic pain. Pain is not a normal aging process in your 40s. So if you're having pain, go and see about it. We shouldn't just accept that we're going to constantly have pain. But do know your limits. Think about inflammation. Again, the foods we eat, our gut permeability or our leaky gut, the toxins that we're exposed to, infections that we have, the stress that we have, all of those things play a role in our inflammation, and that's going to impact our overall health. Making sure that we're taking good care of our eyes, especially now that it's getting sunnier, going to see that ophthalmologist, getting a dilated pupil exam, taking breaks from our electronics. I know I need to do that one. Having blue light blockers, protecting our eyes out in the sun, all important. Using your readers. I need to have my readers on right now. I'm telling you all of the things I need to work on. So it doesn't mean I have it all together, but it's good to have the head knowledge of what you need to do, but then you've got to go and actually do the things. And I always say that knowledge does not equal habit change. You can know what to do, but you've got to actually go do it. And I'm saying that to myself too. Sun exposure is so important to avoid the sun if you can, especially between the hours of 10 and 2 where we are on the equator, and making sure that you have good sun protection. Checking your moles. There's an A, B, C, D, E method, and some people even say F if it just looks funny, if it just looks different than what your normal moles look like. Super passionate about this one. Melanoma has been a big part of our family story and history. So having protective clothing and eyewear and doing a good skin check, going and getting a dermatologist to do a yearly skin check if you have risk factors is important as well. And this is the little ABCDE method. Shingles can also pop up in your 40s and 50s. I had a good friend that had shingles in her 40s just because she was stressed. She was actually just approaching 40 and had a shingles outbreak. Because we're kind of the generation, I think I might be the last generation that actually got chickenpox and didn't get the vaccine. So you just need to kind of be aware if you have a rash around the front area, underwear, like kind of where your ribs would be, underwear like a sports bra would be for women, or on your back, and it's kind of, really speckled looking like this, it may be shingles. Don't touch it. Just go to your healthcare provider and let them look, but it likely is shingles, and it can be painful and itchy. Take care of your good mental health. Think about habit change. Slow progress is still progress. We would love for you to follow us on our social media accounts. Miranda and Ashley and Carolyn do a phenomenal job of managing all of that for us. And I'm going to go to your questions. I know that we're going to be out of time. Y'all are welcome to end at 1 o'clock and you will get your credit, but I will definitely stay on to answer these questions and to get your good feedback. Okay, so I'm going to check these. If a woman hasn't been pregnant in her life and is not planning to have children, does she need to get extra screenings when reaching age 40? Yes, because there are things that when your hormones change during pregnancy, that those are actually can be protective for some things and then not protective for other things. So because you're having more estrogen exposure, because you get a little bit of a break when you're pregnant, your hormones change. And so you may actually need extra screenings, but depending on that. So I hope that answers your question, but absolutely, regardless of pregnancy, do the extra screenings. Hopefully that helps. And all of this, again, is just for informational purposes. It's not to make you fearful. It's really to empower you to go and kind of take action on your health. What is involved in a colorectal screening? Is that a stool sample test? Yes, it can be a simple stool sample test that you do at home or in the office. It can be some blood work. It also could be a colonoscopy, checking for polyps and things like that. So that would be more of a procedural, test. And you can do that usually in an outpatient clinic. That's typically done outpatient here in town. And you get a prep that you drink the night before and the day of. And you're usually out of there in a few hours. So it's a very simple process. I have actually had it done, even though I'm not 40 yet, because I had some irritable bowel syndrome a few years ago. And so it's not bad at all. What is your recommendation for Pap smears after having a total hysterectomy? Your provider should be able to tell you what your risk factors are and if it's appropriate for you to still be screened, because you can still have some atypical cells going on. I have had a partial hysterectomy and I still do have Pap smears, because it doesn't mean that they take all of your cervix even with a total hysterectomy. So it depends on how they did the surgery, and that's going to be unique to you and your provider. But I would not skip it. I would call and ask and see what their recommendation is. But for me, with a partial hysterectomy, I do still have a Pap smear. But thankfully, mine's every 3 years now. Can you recommend a good probiotic? Okay, I have not had a lot of luck with a good probiotic, because if you have a lot of gut issues, bloating, gas, that sort of thing, if you've had irritable bowel or anything like that, probiotics can actually make that worse if you're not doing other things to what we say open up your drainage pathways. So if you're not sweating, if you're not having a bowel movement every day, if you're not crying, if you're not, getting all of that, moving, if you're not urinating to the level that you should, then it's going to be hard for you to take a probiotic and feel great. They actually can make you feel kind of like you've got the flu or kind of have brain fog, which is what happens to me. Seed probiotic is one that's really been highly recommended by people that I trust, but I have not used it yet. I've been waiting on getting my body in a healthier place so that the probiotics work. Most want you to see that you take a probiotic and a prebiotic because they work differently, and sometimes that helps with the gas and bloating. But if you take a probiotic, even if they're great and every Instagram person, loves it and says seed's the best, which is what they say, then if you feel bad, if you feel bloated, if you feel tired or just low mood, then it's probably not a good one for you. Ask your doctor. They're probably going to tell you Floristore. And that's a prescription that they can give or even get it over the counter. But Floristore is usually what they recommend medically, but seed is what you're going to see the fitness people, recommend on Instagram. And that's the one I'm going to try when I get a little healthier and get past my surgery. So those were all the Q&As. We have so many things in the chat. I'm going to run through them quickly and make sure. I'm so glad that this was helpful. Thank you so much. I'm glad we have some repeat people on Zoom. Thank you for that feedback. I'm always glad to hear it. If there's something you would like to see us add, something that you would like to see us go into more detail on, we update these every time we offer them. So I want to make sure that we're giving you relevant information and what you're really excited about. All right, I see lots of links in the chat. Thank you, Miranda, for doing that. You can get personal training and you can reach out to them at UA Rec, and absolutely they can do personal or group fitness. Rec Center has tons and tons of classes. Okay, yes, definitely reach out. If you did not see the answer to your question on the website, then there should be a number on all of those pages and you can reach out and see where you can talk to a person who can give you a good answer. Pap smear test, still good to have? Yes. Okay, so we had 2 questions about the pap smear test. Absolutely. Still want to call and make sure that you don't need it or that you do need it. Between adequate sleep and proper diet for folks above 40, which is more important to focus on health-wise? I think it's easier to control diet first. I actually think it's easier to start with hydration first because it's always easier to add more water in, then focus on your food, then focus on your movement and your mindset, and that's probably going to take care of your sleep. Sleep, you can do everything right, and it's still hard because ultimately you can't not fully control the quantity and the quality. So I think sleep is the hardest. I think hydration is the easiest to start with. And Sleep More, Stress Less is a great program that we typically offer in the fall, that if stress and sleep is an issue for you, definitely think about signing up. No, I am not saying that they will not cover a pap test. I'm saying that your provider may not think that it's necessary for you to do one every year. So no, absolutely not. If your provider says that it's necessary, then I have not had an issue with them covering the cost of that. I'm just saying that most providers don't believe that it's necessary to have one done every year because, you're disturbing those cells on your cervix and they want to do the least invasive thing. Yeah, so do we cover yearly breast ultrasounds? Definitely reach out to HR and to your healthcare provider because it's going to vary. They're going to give you a general answer at HR, but your provider can tell you what's covered for you. They'll have a benefit specialist in their office too. Is 4 to 5 ounces of coffee a day too much? It depends on age and gender in terms of their coffee and caffeine consumption and how much caffeine is in the coffee. Generally, no, I definitely drink 4 to 5 ounces of that a day, but I have a high tolerance for it. So it's just going to be really vary. You're going to see a lot of different recommendations too. Can you go over who should see an ophthalmologist? I think everyone should consult with their primary care to see if they need to go to an ophthalmologist or reach out to an ophthalmologist office. They're not going to turn you away. I have seen an ophthalmologist since I was in the 4th grade, and I just went for optometry, just for reading glasses. So they're probably never going to turn you away. You might not need to be monitored by an ophthalmologist, but I think having a yearly screening, having one screening to see if you have high ocular pressure, which could be like a glaucoma diagnosis to see if you have any issues like with your retina or your nerves. Like, I think that's just a good preventative thing to do as you start to age. But anyone can see an ophthalmologist. I take all 5 of my kids to an ophthalmologist just to check their reading because they were NICU babies. But do they truly need an ophthalmologist? Not all 5 of them do. No, they could go to an optometrist, which is going to be a little more accessible and a little cheaper. But I want to keep a check on their eyes because we have a family history of high ocular pressure. Yeah, okay, so Catherine recommends going and having that done because she got a diagnosis of glaucoma just because she was going to get her readers checked. So that's great. Thank you for that. BMI is a healthy parameter, but it's just a tool. And so it's not the end all be all. I've lost 81 pounds. And if you were to look at me, I think I look like a healthy weight, but I still am considered overweight by the BMI. So, and BMI is a little outdated because it was studied, 150 plus years ago in European countries looking at Caucasian, healthy, middle-aged males. And so all of the things that BMI studies does not, take into, the diversity that we see. It doesn't take into female bodies. It doesn't take into account other variations, which, we should celebrate. So BMI is not the end all be all. It's just a metric. So do what feels good and what helps where you're on track. And if you feel good, if you're close but good, if you're kind of in the range for height and weight, and your provider will know. So if you have concerns about that for anything that we've covered, definitely talk to your provider. Cocoa versus coffee. Yeah, I mean, it just depends on what you add to it, but pure dark chocolate, 80% cacao is going to be better than just plain coffee that you're getting at the local coffee shop. Okay, I want to make sure. Can the topic of fibromyalgia be discussed in the future? Absolutely. We can talk about fibromyalgia and chronic fatigue. We sure can. And if y'all would like to see things like chronic or invisible illness, we can talk about that too. We could develop another class if that's helpful. Okay, y'all, I am so pleased. Like, over half of y'all have stayed on even though we're over time, and I appreciate that because hopefully that means that this was impactful and resonated with y'all. I do believe I covered everything. I see one more. I'm scrolling and I got there. Okay. One person said, thank you for sharing this with us. Okay, awesome. Well, I think I covered everything. I hope y'all have a great rest of your day. If you do need anything, please reach out to Miranda in the Wellness Work-Life office. I will be returning from surgery, hopefully, fingers crossed, in May. And I will be back to wellness classes this summer. So thanks for your time and your attention. And as always, we like to thank y'all for participating with our programs, and we'll get a big roll tide. So bye, y'all. Thanks so much.